WQAD News 8, this is WQAD This Week.
Good morning. It's Sunday, February 19th. Thank you for joining us for News 8 This Week. I'm John Diaz. Eastern Iowa Community Colleges is partnering with the National Alliance for Mental Illness, or NAMI, to offer free mental health seminars in our area over the next few months. Now, the goal is to support people who have friends or family members struggling with mental health issues. This week, we spoke with both organizations to better understand the impact they hope these seminars will have. And joining us now is Paula Ahrens with Eastern Iowa Community Colleges and Lori Edge with NAMI. Thank you to both of you for joining us this week.
Thank you for having us.
Of course, Paula, let me start with you. Get me grounded here on what these classes, these seminars are.
So we're doing a series of seminars that are kind of an introduction. Lori can go more into detail on that, but they're an introduction to the family-to-family classes. And the family-to-family classes, Lori also will give some detail on what those include. But we're offering those through the colleges in Davenport, Clinton, and Muscatine, kind of getting those out into the communities in the Eastern Iowa District area and making those accessible for people in those communities.
And Paula, this is not the first time something like this has been offered. We will get into kind of, as you said, what the classes are specifically, but it's a little bit perhaps newer to some folks because it's not been consistently around. Can you tell us how it came about that you guys partnered together to put on these classes?
Yeah, my husband and I actually participated in a class with Lori and one of her colleagues a while back. We had an individual in our family that was having some struggles, and we went through the program and just really thought it was very helpful, very informative, and they did a great job. And so after that, I kind of was thinking about how we could get that out and into the community a little bit more and help support that.
And Lori, give us a sense of if folks sign up for these seminars, what are they going to be experiencing and walking away with?
Sure. So let me just say that how I like to describe the seminar is that it's a 90-minute trailer of the 8-week class. We give a little tidbit of the 8 weeks in 90 minutes. And let me just say that in no way is the seminar to replace the class. It's just to give people a little something. Many people are in crisis when they come to NAMI. And so the seminar is to give them some tools to begin with until they can attend that 8-week class.
And can you talk about what those tools are, what they look like?
Sure. Then in the 8-week class, basically what we cover is what is a mental health condition. We go over not all mental health conditions, because there's many, but we do go over the main conditions that people might experience. And we also go over what it looks like to get a mental health diagnosis and just understanding the mental health condition and also preparing for a crisis. Like I said, many times people don't come to NAMI until they're in crisis. And even if their loved one then comes out of that crisis, it's a matter of preparing maybe for the next crisis that could happen. We also go over treatment options, communication skills, and problem solving, as well as collaboration, empathy, recovery, and more importantly, for the family member who would be attending the class, we talk about self-care. Because as caregivers of a loved one with a mental health condition, we have to take care of ourselves first. If we don't take care of ourselves, we can't help take care of them. And NAMI strongly believes that support and recovery starts at home. And so that's why we provide the education courses for the family members, because they are that first line of defense and support with their loved ones.
I imagine when folks think about mental health and mental health issues, they are thinking about the individual person who may be going through that, but it really affects entire families, and so the impact is much greater than maybe we initially imagined. Can you give us a sense of why classes like these are so important, what the need is like right now, particularly in the Quad City community?
Well, let me just say that, mental health has been around obviously for a long time. And, but since COVID, there has been an increase of people who are struggling, and including our youth. And so we need to provide an awareness to these family members so that they again can help assist and support their loved one. And suicide is at an all-time high as well right now. And so again, the biggest thing that NAMI likes to stress is the education. And when you understand what you're dealing with, then you can better help support your loved one. And honestly, unless you all of a sudden are faced with crisis in a mental health situation, people don't know about NAMI. They're not seeking NAMI. It's not something anyone would seek out unless they find themselves in that crisis situation. And so that's what we do in providing that education.
Well, obviously, you're kind of paying attention to registration for these classes. What are you seeing so far? I mean, are folks registering for these courses? Is there still space available?
There is still space available. Registration has been steady and good, though. So I would encourage anybody that's interested to call and get registered as soon as possible.
Okay. Are you able to run down when these classes and seminars are going to be offered and where? And then is there anything people need to know in order to participate? Do they need to have certain information handy or anything like that in order to basically sign up?
So you don't need anything. The only thing that with the seminars open to the public, anyone can attend. And you don't need anything. You just show up. There's no cost for any NAMI programs that we provide to the public. And so you can just show up. You can go on to the Eastern Iowa Community College website that I know you're going to provide, John, and register. But honestly, if you don't get a chance to register, you can just show up that night. That's just for the seminar only now. Now, for the class, you are required to register in advance, and the class is only for an adult who has a adult loved one with a mental health condition. We don't, this is not just open to the public, it's open to only to those who have a loved one with a mental health condition. And that can be diagnosed or undiagnosed because sometimes people don't always have a diagnosis, especially right away. And the class size is limited to 20. And again, they would need to register in advance. And the two instructors that lead the class will call everyone who's registered in advance and just have a little bit of conversation with them to introduce themselves to them and, chat with them about who their family member is that may have a diagnosis. We also kind of share a little bit of our own story with them at that point and make it a little more personal. And we also let them know that the class is not a support group. It is a class, it's education. And also, John, I forgot to mention that none of the instructors for NAMI are professionals. We are not licensed psychologists, counselors, social workers, any of that. All of our courses are offered and taught by volunteers who have been trained and certified in the NAMI program. And why we do that is because those leaders for the class have that lived experience. It's kind of that saying, you don't know what I've been through unless you've walked in my shoes. Well, this is the case with NAMI programs. We've all walked in those shoes. The diagnosis might look different, Experiences may be a little different, but the heartache is the same.
And Lori, just so folks know, if they are in a crisis right now, always a good reminder, how can they reach out for help?
Well, first of all, if you're in immediate crisis, we have the new national hotline for mental health and suicide crisis, and that number is 988. If you're in immediate need and need assistance, please call 988. And John, I'd also like to just mention to people that stigma is prevalent when it comes to this physical condition. And I just want people to know that there is help, there is hope, and you are not alone.
All right, Lori Edge, Paula Ahrens, a lot of great information there. And hopefully folks who would benefit from this are able to take advantage of these programs. Thanks so much for taking the time this week. And for more information on these seminars, you can visit the address on your screen, eicc.edu/NAMI, or call the number on your screen, 888-336-3907.